We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Herleth, VP of Member Insights at the Health Management Academy, and your nurse executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. Welcome back to our 3-part series on understanding the perspective of the frontline nurse. Across 3 episodes, I'm unpacking how the frontline thinks about a range of topics, including AI, virtual nursing, safe staffing, and mandated ratios, and discussing where nurses look for trusted information both inside and outside their organization, all with the hope of better communicating transformation and change to the frontline in a way that engages rather than further isolates them. This is episode 2. If you haven't listened to episode 1, please go back and listen to part 1. For those who need a quick recap, I talked about frontline nurses and AI, specifically dispelling the myth that nurses are universally opposed to AI in healthcare. For part 2, I want to get into the tough topic that is often danced around rather than directly discussed, and that's safe staffing and mandated ratios. As a reminder, my team, Nursing Catalyst, conducted across the summer of 2024 research that includes data from our survey of over 400 acute care nurses, as well as insights from our message testing and focus groups with frontline RNs and frontline nurse managers. In both the survey and focus groups, we asked nurses directly about their perceptions of safe staffing at their organization and how they'd want to maintain or improve those safe staffing levels on their unit. The data give us a much deeper and clearer picture of frontline perspectives around safe staffing, including how they categorize staffing today and the solutions that the frontline would like to see in place to help them maintain or improve staffing. To help me unpack these data, I've invited my colleague and Director of Nursing Catalyst Research at the Health Management Academy, Rewers, to join me. Lauren, welcome to the podcast.
Hey, Anne. It's great to join you.
So, Lauren, you've spent many years researching nursing challenges and solutions at the system level, and you directly oversaw the work that we are talking about today around safe staffing. Can you quickly walk our listeners through the topic of frontline nurse perceptions around safe staffing and why we felt it was so important to focus on this topic?
We decided to look into frontline RN perceptions about safe staffing because we're actually seeing a growing divide in the way that frontline nurses and nurse leaders are thinking about how to move nursing forward in ways that feel really important to bridge for our ability to transform nursing. Mm-hmm. To be clear, I think that all parties are aligned that nursing needs to change. Though most health systems have made improvements on the sort of turnover that they were seeing during the height of the pandemic, most health systems aren't in a place in terms of workforce stabilization or labor costs where they would ideally like to be. And of course, that manifests itself directly at the bedside and is felt very deeply by frontline nurses. That being said, when you think about how to move forward from here, what you see is a really binary conversation, either for or against mandated ratios. To be clear, I think that is one of many options that are available, but there's also a wealth of other options that include not only making sure that you have the right number of people at the bedside, but also that you have the right kinds of roles, education, and that you're thinking about how to do the work of nursing in a way that is both efficient and, dare I say, joyful. So what we want to do is to think about how to expand that pretty binary conversation into one in which both parties, frontline nurses and administrators, are able to evaluate the range of options that are available to think about how to move forward on safe staffing beyond this question of pro or anti mandated ratios.
Mm-hmm. And so much of where we needed to start was just understanding how the frontline nurse really thinks about these issues, because I think we all think we know. But certainly having the data in front of us and unpacking that data via focus groups has really been helpful in setting the baseline of, you know, what actually do frontline nurses think. So, could you talk a little bit about what we specifically asked via that survey and in focus groups to understand perceptions?
Our goal overall is to figure out a way for frontline nurses and for leaders who are all working towards a common goal to have conversations that feel as if they're talking with each other and not past each other. And so, what we wanted to do is really deeply understand that perspective of the frontline nurse, such that we are able to tell their CNEs, leaders, and other stakeholders what they care about and how they can get them the information that makes them feel confident working in future nursing practice. To that end, we really looked at four major areas. The first of which was just to get a baseline, right? What does the frontline think about safe staffing today, and how confident are they in their organization's ability to deliver on that? Also, what does the concept safe staffing mean to them in practical terms? We then wanted to explore beyond current state what the future state could look like and how frontline nurses feel about the potential range of options. So we evaluated their sentiment on a variety of different safe staffing solutions. And then lastly, my team also did message testing where we shared several pieces of data with them around the nursing workforce and outcomes data to get their perspective on whether or not those sentiments that they had in regard to safe staffing solutions were changeable.
Got it. So, quite a lot to unpack in this section, hoping we can get through at least a few of the key findings. So, would love to just get right into it in terms of what we found. So, the team found that there were really four key things around safe staffing work that we wanted to unpack. And I think we can walk through each of those in a little bit of detail here, with the first one being that frontline nurses generally voiced low confidence in their organization's commitment or ability to deliver on safe staffing. Can you walk through how we got to that conclusion and really the data that we looked at that drove that conclusion?
Absolutely. Well, just to put that in concrete terms, when we straight up asked the question, how confident are you in your organization's ability to maintain or achieve safe staffing levels, only 7% of respondents said they were confident, which is not great. It's really, really not what you want to see. As we dig into what that means, again, we both collected this quantitative data, but we also solicited a lot of commentary from frontline nurses in focus groups to really help us make sense of where this lack of confidence is coming from. And time again, what we heard is that, hey, yes, I know that my CNO is concerned. I know that my leader is concerned, but I feel like I'm giving them feedback and it's not registering. They're hearing me, but they're not listening to what I'm saying.
And I think, as we had these conversations among the team, but also with our C&E cabinet, which includes more than 50 chief nursing executives from around the country, none of us are really surprised by either the low confidence in staffing or really that rationale behind it. I think what is even more interesting here is why nurses are voicing that low confidence. And you alluded to some of that. And part of it was really that they don't feel informed by what their system is doing or the plans that they have to really invest in staffing or other things that will help staffing. Can you talk a little bit more about what drove how nurses think about safe staffing at their organization?
Absolutely. And even though what I'm about to say, I think can sound pessimistic, I actually think there's great reason for optimism. So for example, you take that 7% figures, only 7% of frontline nurses are confident in their system strategy. That feels, terrifying, honestly, if you're a chief nurse executive or someone, with who's a stakeholder in nursing, generally speaking. But the worst case scenario version of that is that the frontline is acutely aware of what their health system is doing and are explicitly rejecting it. Actually, what we see when we dig into the data, when we ask nurses how aware they are of system efforts to either achieve or maintain that safe staffing level, 57% of them report feeling not informed about those efforts. Now, the fact that they are not informed is not great, but what that really means is that they are reacting to a vacuum of information, not knowing what their system is doing, perhaps not having visibility into some of those transformation efforts that we alluded to earlier, not necessarily explicitly rejecting what those systems are doing. So this is really a call to arms for nursing leadership to think about how to better communicate with their frontline nurses, not necessarily an indicator that they need to drastically change their nursing strategic plan.
Which I would agree is better than we don't believe in what the organization is investing in. This piece around, I just really don't know what's going on, and that lack of information feeling really hard as a frontline clinician to navigate.
Yeah, certainly easier to action on.
Certainly easier to action on.
That being said, not a great place to be in if you're a frontline nurse who
not
is,
great.
Delivering life-saving care.
Exactly. And tough as a leader because, communication in theory is easy. It is not always easy in reality. And we're going to come back to the theme of communication in a few minutes here. I want to bring us to our second big finding. And this one really focused around what to do about staffing. And again, I think a little bit unsurprising here, we found that frontline nurses almost exclusively consider human-centered solutions the answer to safe staffing. And really that means there was doubt around AI or technology being something that can help specifically with safe staffing. And so, Lauren, hoping that you could share some of the types of human-centered solutions that those nurses gravitated towards to really bring this to life.
Absolutely. The way that those frontline nurses were thinking about improving safe staffing was really to get more direct bedside clinicians within their areas of care. So I think the most obvious version of that is one that we briefly mentioned earlier, which is either implementing mandated ratios, nurse to patient ratios, if you haven't had those already, or increasing those ratios if you do. But there's also a number of other options, many of which are being pursued by health systems concurrently to their care transformation efforts that they also gravitated towards. So things like increasing the hiring of support staff to offload some of that below licensed work, to think about creating a staffing committee to weigh in on organizational staffing solutions, as well as to think about general well-being, et cetera. Also, experimental staffing-based solutions, such as implementing team-based care.
And what about things like AI, virtual nursing that can offload some of the workload and give nurses back more time? How did those types of solutions fare with frontline nurses when talking about safe staffing?
I mean, in short, dead last out of 9 available options. Virtual nursing and AI are 8 and 9. And moreover, when we ask nurses, what would the least impactful solutions be? Again, all technology related. So I think seeing a clear split there.
Yeah. And so I think really where this comes down is there is a divide or a bit of a ranking based on solutions in which the frontline is more familiar with, more comfortable with, and solutions that are newer or maybe something that they don't know quite as much about. And I think one of the things that you and I have talked a lot about is really this sentiment around AI and virtual nursing. And this is part of what I talked about in the first part of this 3-part series. But, we've both been pretty adamant about correctly representing how nurses feel about technology and AI and using data like the data we have really carefully, because the sentiment is specific to AI or virtual nursing in support of safe staffing and not general feelings or perceptions about it more broadly, which we also asked about and found that nurses were more ambivalent to positive when thinking about AI generally in the workforce setting. And so would love for you to just reflect a little bit on that and some of the conversations we've had around that, because I think this is an important nuance in how we represent the nursing workforce and the nursing profession and how they think about AI.
When we are digging into why nurses are preferring those more bedside focused solutions over things like transforming work, you see a similar theme to the confidence in safe staffing overall. And that theme is that they are not confident about the ability of technology to actually inflect that safe staffing piece, but that lack of confidence is not necessarily due to bad experiences with these technologies, but rather a lack of information about the way that they work and the potential outcomes that they could generate. Let me back up and share some data along those lines just to illustrate what I mean. So when we asked RNs, completely separate from the other solutions that could potentially be on the table, how confident are you in AI and virtual nursing's ability to inflect safe staffing? 9% of respondents said that they were confident in AI, and 1% of respondents said that they were confident in virtual nursing.
Yeah.
Again, not really what you want to see. But when you look at the top concerns, I would say that they are a little bit different than what I would have expected. So, for example, one thing that we haven't talked about so far, but it feels important to touch on, is that there has been a lot of focus around frontline nursing perceptions in the news. For example, there was a strike with the Kaiser Union against the use of AI in nursing practice just a couple of months ago. And to me, what that indicates is that there's a great deal of concern in the workforce about the potential of AI to either really radically change nursing workflow or potentially even cause nurses to lose some of their job stability.
Mm-hmm.
That's actually not in line with what we're seeing in the data. The number one, by far the greatest concern, the next, concerns being a very steep drop, was the harm to patient quality and experience. I should say the potential harm to patient quality and experience.
Mm-hmm.
So what nurses are saying is, my greatest misgiving about leveraging these technologies in my bedside practice is that I believe that they could potentially be harmful to my patients, or at least I haven't seen the outcomes that I would need to see in order to feel confident in leveraging that in my practice and, banking on these technologies on my license, essentially. That's not to say that we don't see concerns around change to the workflow or the ways in which these technologies might change the profession of the nurse and what the nurse is doing at the bedside, but that is a distant second compared to that concern around impact quality. Again, I'll make the case here that that's actually great news, because every system that I've been working with, every CNE that I've spoken with about these technology is closely tracking these outcomes. And in fact, we do see that many AI use cases, that virtual nursing actually improves patient outcomes. The problem is that communication gap. Those outcomes are not getting fed to the front line.
Yeah. And we're going to come back again and again to this communication gap, this knowledge gap, because it is really at the core of so much of what we found here in terms of what is driving how nurses think about things like AI and virtual nursing. So far in this conversation, we've talked about frontline nurses, frontline acute care nurses, just sort of as one big group, but certainly there are big demographic differences when you look at the workforce. And that is part of the analysis that we did. We found that there were differences, particularly in perceptions around AI and virtual nursing based on years of experience in the nursing workforce. Can you unpack this and maybe some of the other trends that we saw when we took a closer look at demographics?
Yeah, that's a great thing to call out, Anne. What we did is actually analyze our survey data as well as the comments that we had in focus groups by a number of demographics. I would say one of the most important being the tenure of nursing experience of those respondents.
Mm-hmm.
So, for example, when we look at what veteran RNs, meaning RNs with more than 10 years of experience, we see a couple of big distinctions between that group and new graduate nurses. So defined here as those within 1 to 3 years of experience. First of all, veteran nurses are much less confident about their organization's ability to maintain safe staffing. About 48% of them do not feel confident, as opposed to around 40% of those within between 1 to 6 years. So, sort of that early to mid range. And when we look at the kind of solutions that they gravitate toward, that would make them feel confident in their system's ability to maintain safe staffing, a much greater attachment to those bedside clinician focused solutions than technology. So those veteran nurses, 87% of them support increasing mandated nurse to patient ratios, as opposed to 77% of nurses with 1 to 3 years tenure. The other interesting thing to call out around that tenure piece is the way that these nurses feel about technology, broadly speaking. So I think not a surprise, given what I just mentioned about that real attachment to bedside clinician focused solutions, we see a much greater enthusiasm and confidence in things like AI and virtual nursing among those less tenured nurses. But even within that less tenured range, there's a little bit of a distinction, which I think is interesting. So new graduate nurses have 13% of them have a positive perception of AI and virtual nursing, as opposed to those nurses, actually the most highly rated group, which are 4 to 6 years, and have 19% of whom have a positive perception of technology.
Mm-hmm.
So let's take a step back and maybe think about, for those of you listening and has family members who are practicing nurses. And I think it's just helpful to put ourselves in the shoes of various groups of nurses and think about them from their perspectives, because I think all of these tenure groups are behaving in ways that are completely logical given their experiences. For example, when you put yourself in the shoes of an experienced nurse, 10 years plus, I mean, what have they seen in their tenure? But the emergence of the EHR.
Mm-hmm.
Good for a lot of reasons, but also really, really hard on nurses. And so I can totally get why systems are saying, hey, we have this great new technology. I promise it's going to solve all your problems. And they are feeling a little bit dubious about that.
Exactly.
You then look at the younger nurses and think, okay, maybe they have grown up in a little bit of a more technology savvy environment, et cetera, et cetera. But also when you think about that, difference between new graduates and those with 4 to 6 years, what we're seeing is new graduates potentially saying, hey, I literally don't know how to do my basic clinical skills. Please, I beg of you, do not put an experimental technology on top of that. And so I think it makes a lot of sense that we see those nurses within the mid-year range having the greatest degree of enthusiasm.
So this demographic information, really looking at tenure, is interesting, just looking at it by itself, but it's really only as helpful as how we use it. So we're looking at other things like region, union status, other types of demographic information to help us understand not just the frontline nursing workforce overall, but sort of sub pockets of the workforce and what that means when it comes to communication. And so I want to bring us back, Lauren, to really where we started. And that's around, sort of what does all of this mean and what does this data tell us as we think about how to introduce AI, how to introduce virtual nursing, and how to talk about safe staffing. And really what we found in the message testing that you talked about at the very beginning of this episode is that it is possible to shift some of those perceptions that you were talking about. So if 9% of the overall workforce is enthusiastic about AI, can we shift that number? And the answer was yes. In fact, we can do that. And we can do that quite well with the right communication, the right education. And so I'd love for you to talk a little bit more about message testing and just give our audience a primer on what message testing is. And then we can get into really the meat of what we found there.
Yeah, message testing is a technique that's really employed more in the political or advertising arena. Mm-hmm. So essentially you are asking for folks' perspectives on a certain issue or a certain product, then presenting them with some kind of data or message, advertisement, and then re-asking them about that sentiment to get a sense of how that was able to change their minds or not.
And so we did this message testing specifically around solutions for staffing and can we change nurses' minds when we give them a certain amount of information. We found that we can. Can you talk a little bit more about what information we actually put in front of them and how much that influenced their thinking?
The information that we put in front of them was twofold. The first was a series of facts about the nursing workforce itself. So you can think of these as being roughly equivalent to the sort of facts, spreadsheets, conversations that CNEs and other nursing leaders are having every day. Those things are like the nursing supply. Is there a nursing shortage? What would the impact be of a shortage on quality and safety? What would the impact be on hospital finances? As well as how are nurses thinking about their workload today and how would they like to reshape it differently? The second set of facts that we gave our respondents were around the outcomes associated with staffing solutions, including virtual nursing and AI.
So looking at these findings, what does this tell us, or what is your big takeaway for healthcare leaders when it comes to transformation and AI and the frontline?
Most importantly, that the kinds of confidence levels that we're seeing among the front line, and to be clear, I'm sure this is not something that we are just seeing in our very theoretical survey data. I'm sure that this is a characteristic of the pushback and conversations that CNEs and other nursing executives are happening with their own frontline nurses. And there's two things that I take away from this. The first is that frontline nurses' perspectives are in fact changeable, and that when they are given the information that they need in order to feel confident about incorporating this into their practice, namely outcomes data in particular, but also some of the context around the nursing workforce as well, that we see them get so much more confident and changeable in that. And there's something more I want to pull out of that data, which is that, I think we sometimes see headlines around, frontline concerns around leveraging AI, et cetera. And while I appreciate that information being in the market, I think what is so important to remember is that these frontline nurses are dealing with life and death every day. And so they take so seriously their patients' outcomes. And that is something that we should really applaud and make space for. And I think it's completely reasonable that they really want to see outcomes in order to feel confident about leveraging these technologies. So I would really encourage health system leaders, for the technology partners and vendors themselves who are making this technology, to think about how can we really equip the folks who ultimately are the ones who are caring for our sickest and most vulnerable to feel confident in doing so, knowing that there is still work to be done in terms of refining these technologies.
Yeah, I couldn't agree with you more. And I think really what all of this told us, and in the conversations that we've had with executives around the country, is that, the frontline and those frontline perceptions that we started with around safe staffing, they're not great right now. They're about where we thought they would be, but really what this comes down to is our ability to better communicate innovation, transformation, the way in which we want to change things in a way that is engaging to the front line. And so really coming back to that and thinking about what can this tell us and how we craft our communication strategy is a key part of leveraging data like this to help us do our job better, rather than just looking at data for data's sake, even though I know both you and I love to spend time looking at data. Lauren, really appreciate your time and your insights here. It was a pleasure to have you join us and break down some of this information together.
Thanks for having me.
Yeah. For those who want to take a bit of a deeper dive into the data, we're including a short overview of some of the data in our show notes. So feel free to take a look at that and reach out if you have any questions. Otherwise, I hope you'll stay tuned for part 3 on frontline perceptions. In the next episode, we'll dive into where nurses look for trusted information, both inside and outside their organization. And so for those of you who are really thinking about how do I craft that great communication strategy, part of it will certainly be about the message and part of it is about the messenger. So that's what we'll cover next time. Until then, keep innovating. Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.